Hello, everyone. Welcome to today's conversation. So, today we're going to dive into a condition that has affected us probably one time in your life, or you probably know someone that it has happened to. So, this is a very common condition that usually affects our digestive system, which is diarrhea. You've probably experienced it before, or you know about it. But today's conversation, we're gonna explore the causes of it, the treatments, just little things we could do to help us resolve our diarrhea. Or if you're someone that you do suffer from diarrhea, you do have like a chronic challenge, please stay tuned and hopefully you will learn one or two things about it. So, Trudy, let's dive into it and just tell us a little bit about what diarrhea is, just like a simple definition that, to explain what it is.
Okay.
Yeah.
Okay. So diarrhea is a condition that is characterized by frequent passage of loose, watery stools. That's the simplest explanation for what diarrhea is. It's normally accompanied by the urgent need to have a bowel movement, sometimes even abdominal cramp, and also discomfort. So we have spoken previously about what your bowel movement should be and how you should be able to know what your normal bowel movement is. So if this is out of the ordinary, but it is a lot more frequent, then you could possibly be suffering from diarrhea. Now, diarrhea can vary in severity from mild and self-limiting, where literally a few days and you're good, you just need to hydrate. And it can also get quite severe and life-threatening. So depending on the underlying cause, there is different that you could determine what your diarrhea is.
Okay.
Now, sometimes you find that diarrhea is normally accompanied by vomiting, and to be fair, the advice is the same if you either have diarrhea or vomiting, or if you have them if you have them together or you have them separately.
Yeah.
Now, some of the symptoms that you might experience when it comes to diarrhea is things like abdominal cramps, pain, bloating, excessive gas, or just gas. So even not quite excessive, but you could just notice that you're having a lot of bloating as well as gas.
Yeah.
Sometimes also nausea. We have talked about vomiting, which is also quite common with diarrhea. And in cases, some extreme cases, some people might actually experience fever and like chills, where you just feel very, very cold. And of course, you have a high temperature, as well as dehydration. So that kind of, explains, why you'd have dehydration, because you are basically losing a lot more fluid. You are going to the toilet a little bit more than usual, hence why you'd be dehydrated. So these are the common symptoms of diarrhea. Now, not to say that if you have any symptoms outside of this, then probably not diarrhea, or if you have symptoms out of this, it's probably not normal. It could be normal. So diarrhea can be accompanied by a bunch of different symptoms, a bunch of different signs as well.
Yeah.
So whilst talking about sort of diarrhea, what could be a cause for diarrhea, Steph?
Okay. So when it comes to diarrhea, with any stomach issues, like any stomach, it is caused by a lot of things, but the most common cause of diarrhea is the stomach bug, which we usually call like viral gastroenteritis. So this is usually like a mild infection that mostly goes away on its own within a few days. So by you eating maybe food or drink, water that contains like certain bacterial parasites, this can lead to like diarrhea. So usually you do hear people saying, oh, they've got food poisoning. That's and then it usually comes with the problem of diarrhea. So, yeah, basically is when when the food is contaminated, or the water or whatever, or the drink that you're having is contaminated by these parasites. That's what usually causes you to have these symptoms. And so that is the main cause of diarrhea. I will put it that way. Food is like a major thing. The next thing I would say is there are other things that can cause diarrhea, as we already mentioned, like medications, which we've mentioned in our previous episodes in constipation. Medications usually have side effects, and sometimes some may cause diarrhea, some may cause constipation. Like there are different types of groups of medicines that can cause diarrhea. So maybe you may be on certain medications and may notice that maybe after starting that medication, you ended up with diarrhea, which is common. Other causes of diarrhea, I would also put probably food allergies or food intolerance, which we've also mentioned when it came to like the flatulence episode. So usually when you're intolerant to certain foods, you may find that it gives you some gastrointestinal symptoms, which diarrhea may be one of them. So you may find that, okay, I'm probably getting some frequent diarrhea because of this food you're eating. It could be cheese, it could be milk, that sort of thing. So do watch what you're eating. So that could be a cause of it. There are certain diseases as well that causes diarrhea, which Trudy mentioned. Like diarrhea can be accompanied by different symptoms. So these symptoms are usually brought upon by the diseases or the conditions that you have. So for instance, like IBS, you could experience some diarrhea as well as some other symptoms. Also, let's say for instance, you have some inflammatory bowel disease such as Crohn's or ulcerative colitis. Those sort of things could cause diarrhea. Or let's say you even have celiac disease, that could also cause an issue of diarrhea. Like there's so many diseases. One thing I'm not sure if Trudy have heard, but anxiety can also cause diarrhea. I'm not sure about you yet, but there've been certain times where I've been so nervous that instantly I need to go use the loo. It really does happen.
I think any emotional stress can actually trigger that. I've also experienced.
Also there was a time where I think when I used to go to the gym, for some reason straight after exercising I feel really nauseous, and then I have to use the loo. Like it just gives me a bit of like diarrhea. I'm like, wait, where did this come from? But anxiety I definitely noticed that can definitely cause diarrhea. So as Trudy mentioned, any sort of like emotional stress or like changes in your psyche can cause a bit of diarrhea, so which is something that people should be aware of. So other infections as well could also bring upon some some diarrhea. So we just need to basically, when you do have diarrhea, just basically assess yourself and see what is going on. If you are getting some other symptoms, do speak to your GP so that they can investigate whether it is the conditions that you're experiencing and that is causing the diarrhea. And as I also mentioned, definitely watch what you're eating and where you're eating as well, and especially where you're eating. Don't just be eating anywhere, because there are certain restaurants where they do not meet the standards. They say they meet the standards, but truly we all know they don't. So so just be careful, so that you don't cause yourself some food poisoning. So those were the major things, I would say, the main things that causes diarrhea. Is there anything you would like to add on?
I think you've actually mentioned all of them. Most of all you've mentioned is possibly what is more common. Now, again, we always say just because we haven't mentioned it doesn't mean, whatever you're
Yeah.
going through, whatever is that's causing diarrhea is, it's not on the list. No, it probably
Yes.
is. But these are the most common ones.
Common.
I think the only other thing would be sometimes when you're vomiting, or say if you're around someone who's vomiting, and then because of hygiene and things like that, if that is not up to standard as well, you might catch both diarrhea and vomiting. So it can
Yes.
also catch it from, from
Yes.
someone else.
Yes.
But yeah, you have mentioned everything.
Okay. I just actually thought of something as well. Like, how we spoke about laxatives in our constipation episode. So some people may overuse the laxatives, which can actually lead to you getting diarrhea. So long-term use of laxatives when you shouldn't be on it, just know that you will experience some diarrhea. So yeah.
To be fair, that's why some of the laxatives there is quite a bit of a almost control around them.
Yes.
Because people have been known to use laxatives to have diarrhea, and then that way they lose weight. Or at least they think they do. But yeah, so people use it for that reason, and diarrhea is the aftermath, which of course is what they want. So yes, you're right.
Okay.
Yeah.
So I did mention that there are some medications that induces diarrhea. Is it okay if we just go into just the common ones that would normally induce diarrhea so that people are just aware of it? Yeah.
No, of course. So always check with your pharmacist, your doctor, your healthcare provider, what are some of the common side effects if you're concerned about side effects. We're always very cautious about talking about side effects here, because when you read about side effects, sometimes it's also psychological. You read something, you're thinking, oh my God, I'm going to get it, or I don't want to get it, so I'm not taking my medication. But if you want to know a bit more about your medication or about some of the side effects that could be caused by medication, it probably is worth talking to a professional.
Yes.
So antibiotics have been known to cause diarrhea as a side effect. So we're looking at the likes of like erythromycin, clindamycin, amoxicillin, things like that can actually cause diarrhea as a side effect. But it's mostly just because of, when you take some of these antibiotics, they disrupt the normal bacteria that's in the stomach. Therefore, this will lead to diarrhea. So if you're put on antibiotics and you find out that you have diarrhea, chances are it's that medication that is causing your diarrhea. Now, do not stop taking this, because the reason I say this is a lot of people actually stop taking their antibiotics and they say they're allergic to it because they have diarrhea. Diarrhea is a side effect. It's not a sign of an allergy or intolerance to the medication. So if you're having diarrhea, within a few days, that should sort of your body should be tolerant to it, unless it's excessive and it's getting in the way of life. Then seek professionals' advice on what to do next. But yes, antibiotics are known to cause diarrhea. That is probably the most common one. I don't know about yourself, but you hear a lot of that. A lot of patients, who are on antibiotics get diarrhea. Another medication that can cause diarrhea is antacids or anything sort of containing magnesium. Now, because of the way they work by drawing water into the intestines, they can actually lead to loose stools, therefore causing diarrhea. So antacids, especially those containing magnesium, are known to cause diarrhea as a side effect. Now, another group of medication is the NSAID. So the anti-inflammatories that you probably take every day, ibuprofen, or every so often, ibuprofen, naproxen, because of the way they work. And that's why they sometimes advise you take them, not sometimes, always advise you take them with or after food. It's because they can actually irritate the GI tract, the stomach, and therefore this can lead to inflammation and diarrhea. Now, another group of medication that has been known to cause diarrhea as a side effect is metformin. So metformin, which is used for diabetes, has some of the GI side effects. And we have talked about this medication a few times, but this is one of the side effects that can occur with metformin. and this normally has, especially when you start taking it, and then of course it wears off with time, or your body
Yes.
gets tolerant to it. So give it time, your body will be tolerant to it, and the diarrhea will fade.
Yes.
So yes, metformin is known to cause diabetes, to cause diarrhea. It's used for diabetes.
Mm-hmm.
Another group of medication is chemotherapy medication, actually. I suppose because of the radiation, because of the way the radiation, what radiation does, I suppose dividing cells, I suppose in the GI tract, or wherever you're having chemotherapy, wherever you're getting chemotherapy treatment for, this can actually lead to diarrhea.
Okay.
Steph has just mentioned very briefly, but yes, laxatives can actually cause diarrhea. So laxatives, because of the way they work, which is softening the stool so that you're able to go and you're able to relieve your constipation, can soften it a little bit too much, by stimulating that bowel movement. That can cause diarrhea, of course, especially if overused. Now, another group of medication is antidepressants. Now, we have mentioned antidepressants before. So, and also whilst talking about constipation, we have talked about antidepressants. So the SSRIs, like sertraline and even fluoxetine, are actually known to cause diarrhea. So if this is happening, as we say, do not stop the medication, but seek guidance.
Yes.
The last sort of group of drugs that I can think of is proton pump inhibitors, so the likes of omeprazole or esomeprazole. They are meant to protect the stomach, but I suppose by doing that, they are releasing sort of acid that's produced in the stomach, which can affect this sort of, or imbalance the gut, so this can cause diarrhea. So if you're taking omeprazole, esomeprazole, lansoprazole, these kind of medication to help protect the stomach can actually cause diarrhea as a side effect. I don't know if I've missed any others. I don't know if you have any other step that you can think of top of your head.
No, that was very extensive. Like that was the most common ones, like the antibiotics at the top
Yes.
of the list, like the PPIs, as you said. Those are the
Yeah.
most common ones. I think, as I said previously, iron tablets, they affect our guts. So, it could be constipated and it could be diarrhea. Most of the time it's constipated, but some patients do complain of diarrhea. So that's like the only thing I would add to it. Yeah. But there are loads, like, when it comes to medications, there are loads of medications that can cause different side effects when it comes to the digestive system. So we may not have mentioned it, but you could experience it. So
Could be.
it's all about basically just taking the medications and basically monitor yourself. If you do find that the medication you're taking is the one causing diarrhea, do speak to your healthcare professional first. Don't stop the medication, as we always say. Yeah.
That's it. And we always say, don't stop taking medication,
Yes.
or even change your medication without professional guidance.
Yes.
So always speak to a healthcare professional. And the reason I say this is I've had a few patients come in, and we know, as I said, we know something like omeprazole and lansoprazole can cause diarrhea. So they could have that as a side effect. And then they say, because some of this medication, but say a reduced quantity, can be available over the counter. So they say, can I just buy maybe the alternative of the counter? But that might not be suitable for you. There's probably a reason why you were put on that medication. So never self-medicate, never stop or change your medication. Always seek guidance from a professional before doing some of these things. Now, there should be treatment for diarrhea, Steph. Or at least a way to manage diarrhea.
A way, let's put it that way. A way to manage
What is the treatment?
With diarrhea, I mentioned earlier that it's usually self-limiting. Most of the time, like, it usually goes away within a few days, But with some people, the diarrhea can go on a bit longer than usual, or you may find that maybe after 3 days, I'm still going to the loo, and it does happen. What I normally say when it comes to diarrhea, always keep yourself hydrated. So loads of fluids.
Yes.
So literally oral rehydration, that is the key thing when it comes to diarrhea, because just think about it, with diarrhea you're going to the loo, like loose stools is very watery, so your body is losing a lot of fluid. So the best way to help yourself, to treat yourself, is basically replace that fluid. And what I know, well, what they used to say back in my home, especially when you have a stomach bug, they say drink loads of water, it's gonna wash the bug away. So basically
there's probably some truth to that. It's like diluting the bug. Like it could be 100%. By the time you drink this water, it's 20%.
Yes, that's what they used to say. So if you have a stomach bug, you've got diarrhea, okay, my household will just be like, drink loads of water, it's gonna wash that bug away. So key thing, drink loads of fluid. It helps with the rehydration. It also helps get rid of the bacteria, I guess. Yes.
Well, we'll never know.
Yeah. But sometimes people say, okay, they really want to, like, you know, stop the diarrhea. They're just fed up of like going to the loo that often. And I do get it. Like, I do get it. Sometimes you get tired. There is a medication to stop the diarrhea for a few hours, which we do recommend. So this is called loperamide. I'm sure you've heard of it. So Imodium, which is the OTC name for it. So this is an anti-motility drug, which basically stops the diarrhea. It stops your bowel movement. So if you're tired of going to the loo that often, this is the medication you can have. This is the only medication I would recommend. But I am a firm believer of let the virus run its course when it comes to diarrhea. That is me. I'm a firm believer of that. I'm like, honestly, when it happens,
so 7 days, you'll be still like every 2 hours.
No, not 7 days. You know, usually the virus, like, usually 3 days. Come on, Trini, 3 days, it's gone. When it's beyond 3 days, yes, I'm gonna take that loperamide, but I'm a firm believer.
Okay.
Let it run its course.
I thought like the whole time you wouldn't take any medication.
No. No, within like the first 3 days, I'm like, let this thing get out of my system. Like, I don't want to stop.
That's fine.
I don't want to use the drug and stop it, and then I just have that feeling that the bug is still in me. So that's how my brain works.
Yeah.
So I'm a firm believer.
No, but do you know what? I get that. I get that.
Yeah.
Because as we said, it can be self-limiting. It can be mild and self-limiting.
Exactly.
Or it can be severe, where you might need medication or even life-threatening. So yes, no, I totally agree with you.
Yes. So first, I would say 2 to 3 days. Let's put it that way. 2 to 3 days. Do your oral rehydration. And then, after that, yes, definitely do go for loperamide. But so this is like the simple treatment. Like, this is the treatment that I would recommend. But there are other ways as well. Let's say of like preventing like diarrhea, preventing the spread of like these things, which I would say is a treatment, because diarrhea really is a hygiene. When it comes to that, we just need to practice some hygiene routine to help stop spreading this spreading the diarrhea very easily.
This is major. This is important.
Very important, honestly, when it comes to like diarrhea management. It's very, very important. Diarrhea. So if you are someone suffering from diarrhea or even vomiting, the best thing to do is stay away from like work, or if you go to school, just stay away from like the contact of people for at least 2 days. That is the key thing. Make sure that you know, you're away from people so that you don't spread it easily. The other thing, wash your hands. I cannot stress that enough. Wash your hands with soap and water.
No, people eat sandwiches nowadays. It bothers me.
Yes.
You just buy off Tesco, you get your meal deal, and you just eat it.
Yes.
Get into the habit of washing your hands.
It's so important, honestly. Wash your hands even before preparing your food, like after eating, like all of these things. They're so important. After using the loo is so important. Yeah. And those are my basic things. Basically just washing your hands, yeah, to help not spread it,
Hmm.
not sharing like towels,
Yeah.
that sort of thing, utensils, you know.
Yeah.
Yeah, with like someone you and
Yeah.
don't come in contact with someone that has been sick, like is sick. You could obviously see that okay, they're vomiting, they've got diarrhea, and then you go contact them, like, you know, washing your hands, that sort of thing. Do stay away from them. But yeah,
Yeah.
speaking of management and
Yeah.
treatment, those are my main things. Practice your hygiene, oral
Yes.
rehydration, and loperamide. Those are the main things I would say. I'm sure there are some home
Yes.
remedies.
What I also say,
Mm-hmm.
what I also say, Steph, is to wash their clothing, because people
Oh,
don't realize
yes.
that just because you've washed yourself, you washed your hands, that you don't, you know, they might think, oh, like I can still wear my, I don't know, my trousers and travel when I
Yeah,
had a bit of diarrhea, or my bedding. So it's very important to actually
it's
wash
true.
whatever clothing you're wearing, your beddings,
Yes.
because poo, you might not see like poo or vomit, but
Yeah.
sometimes it's there.
Oh, and
That's very
listen, I
important.
saw something. I'm always on these social media. They said when you're flushing, yeah, it's very important to close the toilet
To
because you know when you
yes.
open it, the toilet, the contents of
Hmm.
the toilet is just gonna go into the
The
atmosphere,
pool
go into your, go
into your
into your, into
toothbrush.
yeah, into your clothes. So as Trudy said, important to wash your clothes and stuff.
Mm.
So yeah, that is something. Make sure you close the toilet when you're flushing. Yeah. Yeah. I just
Yeah.
wanted to chip
No,
that in.
100%.
Yeah.
100%.
Um. Mhm.
One more thing I will say as well is I always find out, first of all, if my patients they swim or anything like that. Because sometimes if you're on holiday, there's
Yeah.
a pool, right?
Oh yes.
So you might get diarrhea when you're on holiday, which is quite common.
Yeah.
And then you go to the pool. Like you're like, oh, I had diarrhea yesterday. You go to the pool. I
Mm.
mean, come on. You're not even trying to help the people around you. Normally, it's advisable that after
Yeah.
diarrhea, at least 48 hours after diarrhea, or at least after the symptoms,
Mm.
please just stay in
Stay
your
away.
room. Try not
Yeah.
to, be in contact with people. So the 2 days after diarrhea, try not to go into a swimming pool or anything like that,
Yeah.
because again, it can spread that way.
Yeah. Yeah. I agree. I agree.
Yeah.
Yeah. So initially, you mentioned that with diarrhea, there are some mild diarrhea, there are some severe diarrhea.
Mm-hmm.
What are the symptoms, or when should someone seek for help from like the GP or emergency when they have diarrhea?
Mm-hmm.
Yeah. Or who should seek
Okay.
for that help?
Okay. So some conditions we can manage in the pharmacy.
Mm-hmm.
Some conditions can be managed by your GP, but the GPs are not always open. We are not always open, the pharmacy. So if maybe some of what we've said is happening and is quite severe, you could call 999 or go to A&E. So if you're having severe diarrhea, like you've had diarrhea all through the night, and maybe there's something like blood, you're vomiting, you're vomiting, and you're also having diarrhea that's accompanied with blood,
Yeah.
that is a sign that maybe you need to go to A&E, or you need to seek urgent care.
Yeah.
Sometimes what happens is some people who get diarrhea have severe tummy pains. So if you have really bad tummy pain without diarrhea,
Mm-hmm.
that is a sign that maybe you need to get that checked. Maybe it's not just diarrhea, maybe it's not a stomach bug,
Mm-hmm.
it's probably something else accompanying, this symptom of diarrhea.
Yeah.
Also, sometimes if you know that you have maybe ingested something maybe that's poisonous and that's what's causing your diarrhea, straight to A&E. Not calling your GPs, no coming to the pharmacy, straight to A&E, because we know that sometimes when you ingest some of these things, it can present that way, because again, it is messing up with the normal sort of like flora of the gut. So you might get diarrhea, but no, straight to A&E.
Okay.
Sometimes also what happens is some people experience like a change in like skin color maybe even the lips start turning color. So maybe like a bluey color, maybe they're quite pale.
Yeah.
Or you might even be like the palm of their hands or the soles of their feet are becoming quite pale. That is a sign that maybe you need to get that checked. So
Yes.
straight to A&E. Don't buy, I don't know, like, or don't cover yourself and be like, oh, maybe I'm just cold. No, just go get that checked.
Yeah.
Make sure that there isn't, this is not a cause for concern. And also sometimes diarrhea can actually be accompanied with confusion, or maybe not even responding to sort of like responding as your usual self. So if you're, we all know, say our family members, the people around us, if you notice that maybe your family member has been having diarrhea and they seem quite confused, they're not quite themselves, or even you have diarrhea, but you're like, I'm so confused, what's going on? Like you can't articulate what's going on. That is a sign that maybe you need to get checked. So straight to A&E.
Yeah.
Don't go to the pharmacy. Don't call your GP. I think also another thing is a headache. So if you have severe headache, so you maybe have, say, vomiting, you also have diarrhea, and you have severe headache, that is a need for you to go to see to go to A&E. Again, no pharmacy, no GP, just straight to A&E. Sometimes it might not necessarily mean that you need to go to A&E straight away, but you might want to just get that checked, maybe get that triage, just so you know that, okay, are you just treating it at home? Are you correctly treating it at home? So if you have, say, a baby under 12 months who's having diarrhea, and maybe it's been going on for over a day, maybe get that checked. So call, maybe if you're in the UK, call 111. They will advise you accordingly. But of course, if it's something that's been ongoing, it's a baby today and they're not eating, maybe they breastfeed or they bottle feed and they're not eating and drinking as normal, then that might need an extra check. Also, what I always say actually to my patients is, if there's any child under 5 and you can see that they are dehydrated, because you can tell when a child is dehydrated, you can even see like they're very pale, like they're not quite themselves. And maybe if it's a baby, you're changing the nappy quite often, that might need a check. Okay. I can't think of anything else. Sometimes also if you can't take anything, so especially children, like little children, say if you feel like your child is not able to take anything or to take down to basically ingest anything, so whether it's food, whether it's drink, like as soon as they do, maybe they're vomiting and they're also having diarrhea, that means that even if you give them any hydration, they are not going to take it. That might be a call for concern. So take them to A&E, let them get checked, because they could be suffering from severe dehydration, which is which can be quite bad. So some of these things, what I always say is, you will see when there's a need for you to go to A&E, and if you're not sure about whether there's a need to go to A&E, maybe go to A&E, because if you come to pharmacy and it's if it's 2 days and you've had diarrhea and it's just mild, it's not like literally, or every hour, 3 times an hour, it's just mild, maybe normally you go to your bowel movement is every 3 days and now it's twice a day. Maybe that's not too bad. That's not severe. But if all of a sudden you're having diarrhea every 2 hours, in the night you're having to wake up to go release, go for bowel movement, and it's been, a whole day, it's now going to the second day, maybe get that checked. So you'll always know what is quite severe for you and what is normal for you. Because let's be honest, some people actually have quite frequent and quite loose stools. So if it's quite severe in terms of like it's very far out of your normal habit, then that is a cause for concern.
Definitely.
Unless there's any groups or any symptoms that I've missed, Steph, that you can think of that might want to go to
I think in general, what I would say when it comes to diarrhea, the severity of it may warrant a medical check. So the symptoms that I would normally say that may warrant a medical check will be probably like a diarrhea that comes with like fever, which is not going, maybe, and also with like severe pain, vomiting. And then the key thing, which we always say, any blood or like mucus in the stool that is like of concern, straight away you need to contact your healthcare provider, because that could mean that there could be like an underlying cause of it, so which they need to find out. And especially if the diarrhea as well has been like chronic, has been the for a long time as well, it's not going, as Trudy mentioned, you definitely need to contact your healthcare provider. And also, if let's say for instance you do notice any changes to your weight, where I would say you've lost weight, this could be a sign that probably your body is not absorbing enough nutrients. So you need to speak to your healthcare provider so that they can investigate what is going on. But all in all, like when it comes to severe cases of diarrhea, I think it may be like a sign that there's something major going on, like a serious infection. So please do not wait until like, you know, you will, okay, let me wait, I'll go see my doctor. Do you not wait. If you find out that you're experiencing any of these symptoms, or your bowel movement, it's out of the ordinary, please do seek for medical attention. Don't wait until it's too late. Yeah. But you've mentioned most of it. You've gone through it. Yeah. As you mentioned, diarrhea can cause dehydration. So just watch out for signs of like dehydration. Yeah. So I know we usually go through it. Any myths that you've heard? Because I'm not sure whether there are any myths for diarrhea. The only thing
there's always a myth with everything.
I guess so. I mean, like the only thing I could think of, like you know, I don't know about you, but you know, when someone has diarrhea, we normally say, "Oh, eat some bread." Like, you know, you're gonna be okay. Eat some bread.
I've never heard that.
You haven't? Okay, maybe it's just my household. We normally say, "Oh, eat some bread," because you know bread is quite constipating. So we just they just say either bread and then
do the opposite.
Yes.
Why not eat some yum, some pounded yum? You know, it's going to hold things together.
Yes, I know.
No, I mean, I've not heard that.
Yeah, that's what we normally say in my house. Like, I don't know whether that works, but
does it work?
I mean, you know, bread, or we either say bread or biscuit, like, you know, like cream crackers and stuff. They're quite constipating, so you just eat that, and then it bulks you up a bit.
Really, I've actually never heard that.
Yeah.
I know that I will try it, because then you'll be bloated.
I know. No. Yeah, so that's
but I have had a few myths.
Okay.
About diarrhea. That is nothing to do with bread.
Yes.
So some people say that only spicy food can cause diarrhea, or all spicy food can cause diarrhea. They're like, "Oh, you're having spicy food. Are you not worried about diarrhea?"
Yeah.
You know. So I mean, spicy food can actually trigger diarrhea in some people, depending of course, you know, how sensitive your gut is.
Yes.
But it doesn't mean that all spicy food or only spicy food can cause diarrhea. So this is a myth that people have, where they think that spicy food in general will cause diarrhea. That is not quite the case. It can trigger some diarrhea in some people, especially if some people have things like IBS and things like that. Some foods can actually trigger, you know, a flare up of IBS, and diarrhea will be one of the symptoms or signs. Sorry, the signs that they will experience. So I don't know if you've had that as well, Steph.
Yeah, like actually, when you said it, But I just say it depends on that person, Like, I know someone like you who can take the heat, who will probably say yes, the spice has caused them to have diarrhea. But
that's it.
Yeah, as for me, I think I could take the heat. So I don't think no spice can, but no, I have heard of it. I have heard of it that
Yeah.
spicy food can
Do you
cause
know
diarrhea.
what? For
Yeah,
me, I think like spicy foods,
yeah.
it might go either way, you know?
I know for you, you
It
can't
might go
take the
either
heat,
way.
so definitely,
No.
definitely, yeah.
I've also heard, I don't know if you have as well, Steph, I've
Mm-hmm.
also heard that if you have diarrhea,
Yeah,
people say, oh, you must have eaten something bad if you have diarrhea. So basically, there's
yeah.
that misconception of diarrhea solely being caused by, say, like a
Bad
bug,
food.
you know?
Yeah.
So people sometimes think that it's just caused by, they're like, oh, what did you eat? You know, they
Mm.
say you have diarrhea, what did you eat? And sometimes that's not the case. It's probably not
Yeah.
something someone ingested. You know, as we have said, there is different things
Causes.
that can cause
Yeah.
diarrhea, including even stress. It could be stress, and that's why you're having diarrhea. Maybe your anxiety is through the roof.
Yeah.
That's why you're having diarrhea.
That's true.
Nothing to do with anything you've eaten.
Mm-hmm.
It could probably be caused by something completely different. So
Yes.
that is one misconception or myth that people have.
Yes. Fantastic.
Yeah. Have you thought of any that you might have heard?
No, I can't think of any. I think diarrhea. I don't know. No, I can't think of
Now,
any.
one thing
Yeah.
though, one thing that people say is that diarrhea is contagious. Now, it's not quite contagious, and I wouldn't say necessarily all diarrhea is contagious, but as we have mentioned, it's all to do with hygiene, right? So just because you're I don't know, you know someone who's got diarrhea doesn't necessarily mean that you will catch it, you know,
Yeah.
but you could, because of course hygiene and things like that.
Yes.
So if it's diarrhea that is maybe resulting from medication or maybe even like chronic conditions, it might not necessarily be contagious. So it might be caused just by the medication, and you probably be around them and you'll be fine. So diarrhea does not necessarily make it make the condition contagious.
Yeah.
But some diarrhea you can catch some diarrhea.
Yeah.
Part of it being, hygiene practices and things like that.
Yeah.
I think that's all I can think of, just from what people say or from what I've heard. I can't think of any others.
Yeah.
I think we have actually talked about most of this topic in length. And now one thing I think we haven't mentioned as well is that peppermint oil capsules. We've mentioned peppermint tea, which is very good in sort of like relieving even flatulence and things like that. Peppermint oil capsules are available in the pharmacy. They can also be used for diarrhea. So peppermint oil capsules normally can help with flatulence, diarrhea, constipation. So that might be something that you might want to consider if you're having diarrhea. So Steph, what would be your take-home message on today's episode?
Okay. So we all have a regular bowel movement, but sometimes diarrhea can be uncomfortable and really inconvenient for us. But it shouldn't be something that should stop us, from living, from having that uncomfortable lifestyle. It is very common, as we mentioned. It is something that is self-limiting, and it does resolve after a few days. But if you are someone that is experiencing diarrhea, which is severe, or you just can't live with it, there are some things that we can do. Do watch what is causing your diarrhea. As we mentioned, there are some stomach packs, there are food poisoning, medications, some inflammatory bowel diseases that cause you to have diarrhea. So do watch what is causing you to have the diarrhea and just try to eliminate that or prevent yourself from getting diarrhea by avoiding these triggers. As I mentioned, if it is severe, watch out for some red flags such as blood in your stool, fever, weight loss, so that you can contact your healthcare provider when that happens. Diarrhea can lead to loss of water, which can cause dehydration. So oral rehydration therapy, it's a very important thing when it comes to managing diarrhea. Make sure you drink plenty of water that contains electrolytes, like maybe sugar and salt, which helps, keeps you refreshed and hydrated. So that is very important. If you are someone that maybe the home remedies are not helping, do seek help from your healthcare provider, such as your pharmacist, who can provide you some OTC medications. And if this is not enough, please do contact your doctors so that your doctor can investigate what is going on. But what would be your take-home message, Trudy?
Okay. So diarrhea, as we've said, is very common. And it can result from different things, including infection, maybe dietary factors, medication, and even underlying medical conditions. So know what is causing your diarrhea for effective treatment. And we always advise on hydration. Steph has talked about it in length, and honestly, we always talk about hydration. Like, you don't realize how hydration is key to a lot of things. So always stay hydrated. I always say 5 things. Just stay hydrated. Watch what your diet is, because some foods can actually make your diarrhea worse, or can actually slow the process of you getting through the diarrhea period. So if you're very big on dairy, maybe avoid dairy, any of the sort of fatty foods, foods that's high in fiber, because foods that's high in, we take fiber to help with going. So if you're taking foods that's high in fiber, that's going to keep, the bowel movement going. So it's not going to help with your diarrhea. And also use over-the-counter medication, but under guidance, especially if it's due to an infection. Always get the medication, but under guidance of a professional. And then I always also mention hygiene. It's very, very important. So practice good hygiene, and that includes regular washing of their hands, and this will also help prevent the spread. And finally, seek medical advice if the diarrhea is more than a few days. So if you notice that it's been a few days, you're still getting quite a bit of diarrhea, if it's severe, if it's accompanied by the red flags we've talked about, please seek medical attention. Now, it can be managed effectively with all of these things we've talked about, but always know what your normal bowel habits are, and if it's outside of what the norm is, it could mean that maybe you're having sort of like the persistent severe cases, which might require medication or medical evaluation. So as much as we say it is something that's common, if you've noticed that this is something that's ongoing, so you're having diarrhea, but you're having it quite often, this is a sign that you need to seek medical advice, you need to seek medical guidance.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week.